by chemicals released in that damaged area. Okay, so the chemicals are released. It causes vasodilation, blood vessels to open or get larger, and the blood vessels get more permeable, allowing more things to get into the to get out of the blood and into the injured tissue. And there's a good picture that you'll diagram to help you understand this process of inflammation. So essentially, the blood cells adheres more leukocytes. It's called margination. Diapedesis is when those white blood cells leave the blood to go to the injured tissue. And chemotaxis is the release of chemicals to signal the recruitment of more blood cells. So here is our capillary. Here is our injured tissue. Oh, he fell off his skateboard and he hurt his leg. I've fallen off rollerblades and hurt myself real bad. Okay, so we've introduced bad things into the skin. The bad things actually start releasing chemicals, which signals down here the blood vessel to become more permeable, open up a little bit, and get wider. This allows these white blood cells to leave the blood, slip through the endothelial lining, go into the tissues, and make their way to the site of injury. They phagocytize the bacteria, in this case, release more chemicals, chemotaxis, to allow more diapedesis, the leaving of the white blood cells. Okay, and if you look here, inflammation, you also see a color change in the skin, right, or in the tissue. So, cool. Gotta go back to this slide. So, the effects of inflammation. So, if you've really cut your skin, you really know how it feels like. So, I already said this stuff. So, vasodilation. Okay, next slide. So, it also is red. It's painful. It's swollen because of the extra fluid in that area, often raised above the normal line of the skin, and it's just sensitive. But after about 3 days, the inflammatory response should slow down. The host cells are dying. The neutrophils are actually, if we go back here, the neutrophils are the first cell to get there and start eating the bacteria. Okay, so yeah, redness, heat, I forgot heat. So it feels warm in that area because of more blood in the area, and blood carries heat, swelling, pain, and inflammation can cause loss of function temporarily, just from pain and swelling. And the pain is also due to extra fluid in the area, kind of pushing on everything and the chemicals within that area. And there's different types of inflammation. Acute is 8 to 10 days. Sudden inflammation that just happens. Chronic inflammation is very long-term, more than that. Chronic area of your body that's inflamed. I think of our rheumatoid arthritis when I think of chronic inflammation. Their joints are always inflamed, and that can have detrimental effects. So that's inflammation. The next physiological process that's innate, your body has this system to help protect itself. Non-specifically, it's called a fever. We've probably all had a fever, and the reasons for that will be talked about. So a fever is when you're 1 degree Celsius or more above normal. And that's normal for Celsius is 37 degrees. And what causes the fever? These chemicals called pyrogens are released from your immune system cells or infected cells. Fever is a good thing. There are benefits. I know growing up I always thought, okay, fever is so bad, and let's get rid of the fever. But the fever is actually telling you that your body is working, your immune system is working to fight itself. or to fight for itself. It promotes interferons, those are their chemicals, increases the activity of the adaptive immune system, so our specific immune system. It makes the tissue repair more quickly. And it is recommended if you have a low-grade fever to just not treat it. Don't take Tylenol to reduce the fever, because the fever is serving a purpose. Oh no, not again.
I want a video, you dumb.
I'm so sorry. So weird. Okay. Next, there are some risks of a high fever. And this is probably what you're more familiar with. If it's for little children, if it gets above 103, it's potentially dangerous. It's a little bit lower in an adult dangerous fever. What happens is your body's made up of many proteins, different metabolic pathways that make energy to keep you kicking. Those proteins can start to denature or break down, and then they can't do their jobs if your body gets too hot. So, and it can also induce seizures. And here's where, I can't imagine, but if it gets above a 106, make sure you use a proper thermometer, okay? Because I know sometimes I've taken my kid's fever. I mean, you could do the temp on the forehead using the one in the ear, and then I also have an oral one. The inside the body are the more accurate, so underneath the tongue or in the rectum for little kids is the most accurate. But if it gets above 106, it can cause irreversible brain damage and death likely if it's above 109. So you do have to control it to some point. Next, I mentioned pus earlier, but let's talk about it again. When those white blood cells take in the bad things, okay, it kills them. The white blood cell dies too, okay, and the debris that comes with it produces the pus. You can release it through the skin, or your lymphatic system will essentially take it away from the area. But if that pus isn't cleared from that tissue area, it can form what's called an abscess. All that pus is stuck and can't get out. Ew. So how do we treat acute inflammation? Acute, I wrote down here, just to remind everybody, short duration, recent onset. So I twist my ankle. I cut myself, okay? Acute, just happened. I have sore, it's red. How do I treat it? Ice is recommended for an acute inflammation. What that ice does is those blood vessels want to be large. It helps make them smaller to decrease the inflammatory response. It just makes it less painful. But chronic inflammation for longer than 2 weeks, the white blood cells are going, macrophages, lymphocytes, and it can occur from overuse. So if you've ever heard of shin splints or tennis elbow, those are chronic inflammation. And like I said, with rheumatoid arthritis, that's an autoimmune disorder that causes chronic inflammation. And eventually, if you don't treat this chronic inflammation, it can lead to scars and tissue destruction in the areas. Okay, so you should be able to name some differences between adaptive and innate immunity. You should be able to give 4 examples of how the complement works in the innate immune system. You should be able to name some cardinal signs, or how do you know that area is inflamed, things you look for. And that is the end of the innate immune system.